Okay, so it's 6:02. So we're going to start. Um, Before we start, I wanted to let people know that we are going to be recording this webinar. So if you don't want to be part of the recording, either you can leave and we will have this available as a recorded video to watch later, or be aware that if you ask a question, it could be on the video. And additionally, we have the chat function going, so that if you're not on the phone, but if you're watching this through WebEx as a webinar, you can type a question into the chat and we will read it and ask our panelists the question. So different ways to to speak to us. Also, we'll have a way for you to contact us after the presentation. So today we have a webinar called Beat the Heat and Respect the Water, Essential Summer Safety. And we have two panelists today. We have Dr. Isha Chen, who is our Director of the Division for School Health Services, and Dr. Nolan O'Dowd, who's our Bureau Director for Clinical Services. So thank you both for being here tonight and presenting. And I will turn it over to you and mute myself. Thanks.
All right, thank you, Dr. Wilson, for the introduction. So we're going to go ahead and get started. We're going to start by talking about the heat. Let's see, oh, here we go. So how do we beat the heat and prevent heat-related illness? Okay. Oh. Okay, so for some background, actually, hold on. I'm gonna send the control back to Dr. O'Dowd because he's sharing the slides. If you could go back to the first one. Thank you. So for the background information, heat waves, as we have all been experiencing, are becoming more intense and more frequent. We've gone through many waves of high, heat advisories this summer, so we all can experience this on a day-to-day basis. And with that, heat-related illness and unfortunately death also are on the rise. So that's why we're talking about this topic today. And another thing we want to emphasize in this part of the talk is that heat illness affects some people more than other people. So we're going to be going over who's most at risk. And of course, there are steps we can take to prevent heat illness. So we will be talking about that. So, okay. So we talked about why it's important, but how much at risk are we really in Baltimore County? So we talked about how heat risk is kind of up across the country for reasons that we mentioned, but in particular, Baltimore County is actually quite vulnerable. So this image here is a screenshot from the FEMA National Risk Index that you can look at for the risk in your community for various different things like flooding and things like that. And so this particular screenshot is showing the heat wave risk. And it takes into account the actual weather that a community experiences in addition to their social vulnerability. So we can see here that in the red circle, we have Baltimore County, and it is unfortunately in the darkest color, showing that it is at the highest level of risk. So our county is exposed to high heat and also is not able to overall, our community has a harder time on average dealing with the heat. So that's why we really want to emphasize the heat illness prevention steps today. Next slide, please. All right, so here we have a chart showing the number of people going to the emergency department or urgent care over the summer for heat illness in the state of Maryland. And so there's 3 different years shown here. The yellow or diamond shape, that's 2023. The orange or square is 2024. And then you can see the red circle is 2025. And we're about halfway through our overall heat season. And we can see that this red line is quite a bit higher than it has been, we've had in terms of people seeking care for heat illness in the past couple of years. And we still have many weeks to go in the heat season. So again, this is why we're bringing this up today. Right. Next slide. Okay, so here we have the number of heat-related deaths in Maryland by year. So unfortunately, we have already had 12 deaths from heat illness in the state of Maryland so far this calendar year, and 2 of them were in Baltimore County. In the past 5 years, we've had some good years and bad years, and it seems like this year, just because we're only about halfway through the season and we're already at 12, this one could end up being a bad year, but hopefully if we take some of the steps that we talk about today, we can prevent that from happening. Right. Next slide. So what we're looking at now is the number of people in different age groups who visit the emergency department or urgent care in like a snapshot of time in 1 week earlier this month for the entire state of Maryland. And this is, you can see the numbers by age group here. So I wanted to point out that the highest users of the emergency department and urgent care for heat-related illness is this 18 to 44-year-old age group. And it's less frequent in the older age groups for people to be seeking care for heat-related issues. And luckily, it's less commonly seen in the younger folks as well. But if we go to the next slide, we can see that the trend for the actual people that are affected most severely, that they pass away from heat-related illness is very different. So the 18 to 44-year-olds, they might, feel sick and go to the hospital or the urgent care. But the people that are suffering the most consequences are your 65 plus and the younger cohort as well. So who is most at risk? We have the elderly and children and pregnant people, because they are all less able to tolerate changes in temperature, and their body is not able to regulate temperature very well. And then also people with heart or lung disease, and then people who work outside. Outdoor workers obviously are exposed more, so that's the reason. And then pets, we can't forget about pets. Many of our pets are not equipped to be dealing with, the inferno that we've been living in recently. So these are the groups that are most at risk. Next slide. So now we've gone over all these scary statistics. What can we actually do about heat illness? Next slide, please. So staying safe in hot weather, there's many tips. So what we want to do, our do's are wearing hats, sunglasses, and sunscreen. That's just general protection from the sun and damage from the sun. And taking steps to avoid exposure to the hottest parts of the day, which are those midday hours from like 10 to like 3 or 4. Those are the times that if you do not have AC at home or are not able to find a cool place to be, then there are cooling locations throughout the county that our social media does send out whenever there is a high heat situation. But generally speaking, the public libraries, malls, these are locations that you can go to stay cool if you don't have access where you are otherwise. And if you're overheating, you can always, take a cool shower or bath. That tends to cool you down as well. Other things that we want to definitely do is drink liquids, and those liquids should be water, not things with caffeine or alcohol, because those will dehydrate you more. And then in terms of what you wear, light colored, loose fitting clothes that will allow you to sweat and actually cool yourself down, and will be the best for, giving yourself breathing room. And in terms of what we don't want to do, so we kind of covered this, stay outside at midday, want to be indoors for sure. the reason I put the blasting the AC too high, that's a little bit more of a point related to not putting too much stress on our energy grid as a community, because if we all were to set our ACs at 65 degrees when it's 95 degrees outside, your AC will not actually be able to cool your home to 65 degrees. That is not possible. It will end up burning out, and then you'll be very sad that you have a very high repair bill for your AC. But then also you'll just be draining a lot of electricity to your particular location, and that will put more stress on the grid. So there's always this push for turning the AC temperature up a little bit higher and then using a fan. So if it's less than 90 degrees where you are, using a fan does effectively help cool you. So using a combination of the AC and fan is a great way to stay cool. And other kind of common sense things here is just making sure if it's too hot, don't exercise outdoors. Find an indoor place to exercise. All right, next slide. Okay, and then I want to talk about the actual signs of heat exhaustion and heat stroke, which are kind of the two extremes of heat illness. So heat exhaustion is, when you are very thirsty, you might be sweating really heavily. It might start feeling a little bit of nausea, some weakness, maybe some dizziness, but it's more on the milder side. This is when it's adequate to just move to a cooler area, loosen up whatever you're wearing, drink some cool water. And if you continue to feel worse, then that is when you would want to seek medical help. But if you or someone that you are around is experiencing more confusion, like a severe headache, if they actually stop sweating, but they seem to be quite overheating, these are all really bad signs of heat stroke, which is, your body can only tolerate so much, right? So you're basically, your body starts shutting down and you might even completely pass out. So that is when you call 911 and make sure that the person gets care as soon as possible. You want to remove any extra layers of clothing they might have on, and cool them down with some cool water or ice. There's actually a recommendation to not give them liquids because they could pass out and then they might choke. So you want to just try to cool their body externally, and try to move them to a cooler area. So, all right, next slide. And overall, we talked a little bit about looking for these signs in other people, but and preventing heat illness for ourselves. But really, some of the things that we can do as a community to keep ourselves all protected from heat illness is make sure if you see a child stuck in a car, if you look around, you don't see any adults coming, to get this child, the child's by themselves, call 911. A child can suffer from heat illness very quickly in a car, even if the window is cracked open. That really doesn't help that much. So this would be a reason to make sure that the child can be removed from the car and be able to cool down a little bit. And actually, to prevent kids from finding themselves in a car, you should lock your car when you leave so nobody accidentally wanders in. And then in terms of the people that are most at risk that we had mentioned earlier, it's nice to just check on people that you know that are at risk, check on your elderly family members and neighbors and see if they need any assistance, make sure that they have, working AC or fans, and if they need transportation to a cool place in the hottest time of the day, you can help them out with that. Just make sure that they have everything that they need to stay safe during these hot times. All right, next slide. So now we're going to play a short PSA related to preventing heat illness in kids, and specifically it's about kids and cars that we had mentioned. I wanted to bring this up because we often hear most about like, oh, a child, you know, passed away being stuck in a car. So this is something that's like the most preventable way that you can prevent heat illness, is just to not do this. And unfortunately, the situation here where the child was left in the car did happen earlier this year in Maryland. A 6-month-old passed away. So we'd like to touch on this.
We said we'd never break the 3-second rule. We'd never make a separate dinner. And never do that. We'd never let them sleep in our room. And never become a minivan mom.
Hey, Chris.
Okay, well, I'm not at my desk right now. As parents, we say never a lot, but never happens. So when you say you'd never leave your child in a hot car, no, it can happen. Before you leave the car, always stop, look, lock.
All right, so thank you for listening to our portion about beating the heat in the summer. We can go ahead and advance to the next slide. Nope. I don't know that anybody wants to watch that video again. It's a little intense.
Before we go on, we did have some good questions in the chat. So I thought I could read them to you because I know you're monitoring the slides, so it's harder to look at the chat.
Oh, yes. Thank you, Dr. Wilson.
So the person wrote in, I work in the harm reduction field and a lot of clients are homeless. How can one protect them? And how would you know if someone is suffering from heat exhaustion or in the process of drug overdose? How would you tell between somebody who was having extreme heat exhaustion or stroke versus drug overdose? So how to protect, and then how would you know?
Okay, so in terms of how to protect unhoused individuals that you might come across in work or otherwise, the cooling centers that I mentioned earlier, those are available to the general public. There are identified locations where they allow anybody to go in and stay cool during the hottest parts of the day. So again, we send out that information routinely whenever there is a heat advisory, and it can also be found pretty visibly on our website as well. And we update it regularly to make sure that everybody, like all the information that's on there is accurate, and you're not going to get kicked out of any of the places that you send people. So the cooling centers would be the biggest thing. And then also just making sure that people have water. If you have, a water bottle you could share, making sure people are staying hydrated. If you notice that they're wearing a lot of things, like help maybe give them a bag or something so they can take off some extra layers of clothes if they don't have a place to put those extra belongings, things like that would certainly help. And then in terms of determining if somebody is having a severe heat illness reaction or having an overdose, you could check their pupils. That would be one thing. If they're passed out and you open up their eye and take a look, and their eyes are, like pinpoint, like you can barely see their pupils, that would be an indication for sure. If they are sweating, then it's probably a little bit less likely. Well, it depends. If they're sweating a lot, then it still could be heat illness, but if it gets to a certain point, they stop sweating entirely. So one thing that you could always do, because nothing's going to happen if they're not overdosing, is to give Narcan. And if that wakes them up, then you fix the problem. And if it doesn't wake them up, then call 911. They're having a heat emergency. So there's always that option too. So hopefully that answered your question.
Thank you. And that's the thing, you might not know. So if somebody looks like they're critically ill, call 911. And just on the side of safety, if you have Narcan after you called 911, you could try to administer it. But either way, that person sounds like they're in some kind of emergency. So thanks.
Yes, thank
Those are
you.
great questions.
That's a good point. You should call 911 either way. Thank you, Dr. Wilson.
Yeah, good questions. Thanks. Keep the questions coming.
All right. Well, thanks, Dr. Jen. I think we'll move into the water safety section now. So this is another summer topic. And it's good timing because just last week was World Drowning Prevention Day. And of course, drowning's similar to heat. We're talking about it because it is a relevant issue to our summertime weather. So let's jump in. So to start, we're going to just review some numbers to give us an idea of the problem and the scope. So every year in the United States, there are more than 4,000 drowning deaths. Most of them actually do occur in the summer, 42% in July even. Now, among children ages 1 to 4, this is the leading cause of death. So it's a very important issue for this age group. As well as other, children in older age groups as well. And here in Baltimore County, we've actually been seeing increasing rates year over year since 2020, unfortunately. So for us, it's an important topic to cover in our county. So now to understand drowning and to kind of understand how we should prevent it, it's important to kind of understand who's affected, right? Who's most at risk. So what you're seeing here is a couple graphs that is actually from our local data from the Child Fatality Review Team. So since 2020, we're looking at just kind of aggregate percentages here. So starting from the left-hand side, you can see that, for us, and this actually it resembles the same trends that you see at the national level. Boys are more at risk than girls. So kind of a twofold difference here. We just talked about the age groups. So age 1 to 4, obviously that is a big group at risk, but that doesn't leave out the other kids, right? So 5 to 14 is also a significant portion of the deaths that we saw in this time frame. And then something that we don't always think about, but is important, is medical conditions, and particularly behavioral conditions. So a good proportion of the deaths that we saw in our county happen in kids with some form of behavioral illness. So think about conditions where children might have a tendency to wander or to elope. Autism is a common one to think of. Those conditions do come with a higher risk of drowning. Race is also a really important characteristic, and we'll talk about this a little bit more later on. But this does get at the underlying fact that racial equity is a contributing issue for drowning as a problem. We see a much greater share of drownings in Black children compared to other races. And then these last two graphs, they show a few things about the environment where a drowning has occurred. And they're important to think about, again, when you think about how are you going to prevent drowning. So on the left, you see this is time out of sight. So the last time that child was in sight of, a caretaker, an adult. So in most cases, it was less than 30 minutes that the child is out of sight. So the take-home message there is that drowning is quick, and it does not take long for a child to find their way to a pool or another body of water. And then on the right-hand side, this is the type of water where we saw in our local data drownings occur. So most of these cases were in a private pool. Think of a backyard pool, whether it's above ground or underground. that is the most common. We just recently shared in social media actually a recall, I think it was just this week or maybe last week, of a very common above ground pool where there's some straps that kind of hug the outside of the walls of the pool. And there's been a number of cases reported where kids could kind of use it as a foothold and get access to the pool. And caught their caretakers off guard. We're not thinking that they could access the pool. So just a mini PSA within this presentation for that recall on that type of pool. You can look for that information online. Just search. I'm sure you'll find a news article recently about the recall, or you can visit our social media pages. Okay, so we're gonna move into prevention, and I'm going to show this is an excellent video from the National Drowning Prevention Alliance, and they do a much better job than I ever would of going through the layers of protection when we think about drowning. So we're going to watch this and come back.
Water, one of life's true joys. It can bring us together and be a source of lifelong memories. Water is also an element that requires our respect. Water can be dangerous, and it can be deadly. Drowning is the single leading cause of death for children ages 1 to 4. Drowning is fast, silent, and not what you'd expect. Drowning is also preventable. There is no single way to stop a drowning from occurring, but by applying all 5 layers of protection, you can prevent it and save lives. Fences, barriers and alarms, supervision, water competency and swim skills, life jackets, and emergency preparation make up the 5 layers of protection. If you love kids, you know they can be curious, quick, and impulsive. One second they're there, and a moment later, they're off to someplace new. Most of us do our very best to watch children during swim times, but most drownings occur during non-swim times, when adults are no longer thinking about the pool, which is why it's so important to ensure they can't access water on their own. A 4-sided fence with a locking gate can reduce the risk of drowning by 50%. Doors, windows, and gates that provide access to water can be alarmed. There are even personal alarms that can be worn to keep a child safe. As a caregiver, it's your job to stay vigilant. If there's a pool, you need to know where the kids in your care are at all times, inside and out. A child can drown silently in as few as 30 seconds. That's about how long it takes to reply to a text message or wash your hands. So designate a water watcher, whose job it is to watch your child in and around water. And, if possible, swim near a lifeguard. And remember, if a child is missing, always check the pool first. Seconds count. Children can learn water competency and swim skills at a young age. From learning to float to eventually learning to swim safely, these water safety skills are critical to survival and can decrease the risk of drowning by up to 90% for children ages 1 through 4. When you're in or around natural bodies of water, such as lakes, ponds, and rivers, U.S. Coast Guard approved life jackets are essential to keeping your children safe. Whether you're out on a boat or just spending a day at the dock, life jackets should be a critical part of your day. Because supervision can never be perfect, life jackets can also be an important layer of protection for kids who lack water competency when around water. And please remember, life jackets can only work if they fit properly. Adult life jackets will not work for children. The final layer is emergency preparation. If you own a pool, you need to be prepared. That means learning CPR with rescue breaths and basic water rescue techniques from a qualified instructor. Water. an oasis, a place for family and friends and joy. And, to a curious young mind, a fascinating and mysterious thing that sometimes calls out to be explored. Please learn and share the 5 layers of protection so we can put an end to childhood drowning as the single leading cause of death among children ages 1 through 4. To learn more, please visit us at ndpa.org/layers.
All right. So, so that video, of course, great job of going through layers of prevention. So we also have a flyer that was developed by the health department here in Baltimore County. That's very similar. Goes through these steps to take to prevent drownings, and puts it in a nice mnemonic. So this is a flyer that we've shared, through our social media channels. And you can always reach out to the health department, and we'd be happy to share it with you or an organization you work with. It goes through the same similar prevention strategies. So S for swim skills, I for install alarms, L is for layers of protection, meaning to make sure you have a fence with a locking gate. E is for eyes, so make sure you have eyes on the pool, a designated watcher. N, never leave the children alone. Check the pool first if a child is missing as well. And T is turn off phones. They can be a big distraction and keep you from your supervision of children. Okay, and then finally, I wanted to end with this slide. So about a year ago, is 2024, the CDC, they conducted a survey, and this was actually of adults. And it was just simply asking if adults have had swim lessons at any time in their life. Surprisingly, less than half of adults in the United States reported having swim lessons. But as you can see, the rates are quite different depending on your race. And so we talked about this a little bit earlier. So per their survey, Hispanic and Black adults had much lower rates of having had swim lessons. And this gets to, again, the racial equity component of drowning as an issue. And, there's many historical and structural factors that go into, access to pools. And, those are part and important parts of this issue, out of the context of, what we are here to cover today, but just to recognize those issues. Also, with that in mind, we have a few resources in the final slide of this presentation that are from some really great organizations that are working to increase access to swim lessons for populations that are in need. So there's one in particular for Black children that provides sort of an amount to go towards, sort of a coupon towards swim lessons. There's also an organization that works with autism, children with autism. So look for those resources on the final page, and we'll also have those posted when this goes into our YouTube. So I wanted to end with just a few key points, the take-home messages, if you will. Number one, drowning is fast and it's silent. It doesn't always resemble what you might, remember from a movie scene. It can happen quickly and with really no warning. Number two, Black children and children with behavioral conditions are at highest risk, and those are, where we need to have extra precaution and really ensure that our layers of protection are strongest. And number three, of course, every drowning is preventable. So going back to those 5 layers, thinking back to the flyer with our mnemonic, and just to kind of summarize the major points there, swim lessons, a safe environment around the pool or the body of water, and supervision are key to preventing drownings. So with that, we have our resource page here. So Dr. Jen pulled together some resources around heat illness. And on the right-hand side, we have our water safety and swim lesson resources. So I'd mentioned this is the organization Outdoor Afro. Making Waves is the name of the program, and they provide up to $200 for swim lessons. And there's also a scholarship from the Pathfinders for Autism. Also, Aetna is just the Medicaid managed care organization. If you have Aetna Better Health coverage, they offer $50 towards swim lessons as well, which is kind of a nice benefit. Dr. Jen, I don't know if you wanted to review any of the resources on your side too.
Yeah, so on the top here, I have how to sign up for emergency alerts through the Baltimore County government, and that will give you alerts about any type of weather issue mostly. So they will let you know if there is a heat advisory. And so those are the days where you want to be especially mindful of all the tips that we talked about. And it's a good way to make sure that you're up to date on how the weather is going to be on a particular day. And then in terms of the other links I have there, those are mostly information for particular groups. So there's the first one is for older adults. There's a link for how to keep kids safe in particular, like specifically when the temperature is very high, and then just more information about heat-related illnesses, talking about a more detailed list of symptoms, kind of the other things that we didn't mention, like heat rash and things like that, how you can handle that if it comes up, and just a more detailed explanation than we went into in this webinar.
Excellent. Thank you. I'm giving you some clapping hands. Thank you for that informative presentation. Does anyone have any questions? Anyone in the audience either want to put them in the chat or just speak up? It's a small group, so I don't think anyone would mind if you just speak out. I think another thing that made me think about is in terms of water safety is if you or your caregivers get CPR training. So make sure if your babysitters or people caring for your kids have some basic life-saving capabilities. And there are, community courses for CPR, so you can get yourself trained and certified for that. So we really appreciate everyone coming out tonight and everyone's time and the expertise of our presenters. And we will put this information on our website, and there should also be information there on our health department website for how to contact if there are additional questions. So thanks everybody, and have a good night, and stay cool and safe out there in that summer.
Thank you.
Thanks. Bye all.